All right, good morning, everyone. Again, thank you for coming. We're going to turn this over here in a moment to State Representative Brian Lanoue. We'll have a series of speakers this morning, and then following that, you will have an opportunity to ask some questions. All you need to do is just put your name and your news organization in the chat box, and we'll take them first come, first serve. And with that, I'll turn it over to State Representative Brian Lanoue. Thank you.
Thank you, Michael. Good morning, everyone. I want to thank the members of the media for being here today. I hope everybody is healthy and safe, and want to thank you for braving the storm, for being with us on this virtual platform. A little bit of uncharted territory for all of us. But today I'm here. I want to thank Robin Green, the ranking member of the Public Safety Committee, Deputy Republican Leader Jason Perillo, and somebody I'm very proud to represent as a constituent, Miranda Mahoney, who is a project coordinator for Griswold Pride. Today we're here to discuss a very important bill and a very important topic. It's House Bill 5586, and this is an act requiring the expansion of the crisis initiative. It's a pilot program throughout the state of Connecticut. We all know somebody, whether it's a friend, a relative, someone in our community who has been plagued by the opioid epidemic. We have all been impacted by that in some way. The CDC numbers from 2019 to 2020 have shown a record, unfortunately, a record high 81,000 overdoses nationally, 81,000 lives lost due to this epidemic in that 12-month period. Over 1,200 of those lives were lost right here in Connecticut. On top of this, COVID-19 has created even more isolation and more job loss, which has increased we have seen even a greater uptick in the opioid epidemic, substance abuse, mental health disorders. But there's a beacon of hope. There's that we can offer you, something that has been proven to be successful as a pilot program. I'm very proud to say started off as in the pilot community, was launched right in my hometown of Griswold, and is now a pilot initiative since 2017 in the Troop E State Police jurisdiction in New London County, and that is the Crisis Initiative, the Crisis Pilot Initiative. This brings together both our law enforcement and mental health professionals. This our state police and also our local police within that jurisdiction has access to a DEMIS clinician who is attached directly to the troop. And both our police and clinician are CIT certified, crisis intervention training, which gives them more advanced de-escalation training techniques, as well as when police during their acting as police officers in the course work of their law enforcement duties, if they come in contact with somebody who, whether it's through a call or community-oriented policing, finds that there's somebody who is suffering from substance abuse, suffering from a mental health disorder, gives a referral directly to the clinician. That clinician does the follow-up. So we have that direct pipeline where law enforcement and the mental health community are working together. Since the inception of this program, there's been nearly 600 referrals and 500 clinical follow-ups. So these are very, it's just the amount, these numbers are disturbing, yet we know that there's now a pipeline where we're getting these people into the proper, hopefully the proper treatment, getting them, identifying who they are, and helping them accordingly. The history of this legislation, it started off in 2019. I had proposed a bill to expand the crisis initiative into the Troop D region, which is essentially up in Windham County, which is the other part of my district. Miranda testified with me at that time. We introduced this to the Public Safety Committee, and last year in 2020, the House Republican Caucus opened this with open arms. Absolutely loved the concept, and we made it a caucus initiative. Unfortunately, due to COVID shutdown, everything halted. But we are re-resurrecting this caucus initiative this year, and where we're going to expand this. The aim is to expand this not only into Troop D in Windham County, but throughout the entire state of Connecticut to expand this. And I want to thank the leadership team. I want to thank Vin Candelar and Jason Perillo, Deputy Leader Jason Perillo, Ranking Member Green, and the entire caucus for really getting behind us and supporting us and supporting what we're trying to do. And it is very, very exciting. And at this time, I want to introduce, I'm very, very proud to introduce my Deputy Leader, the Deputy Leader of the House Republican Caucus, Jason Perillo.
Representative Lanoue, thank you very much. And I just want to say that the House Republican Caucus is standing strongly behind this issue, not just because it's the right thing to do, but because Representative Lanoue won't stop bothering us about it. He is very proud of this initiative. He is very proud of his relationship with Griswold Pride and the work that they've done together to advance this. As Representative Lanoue said, this was a priority for us last year. And things sort of went sideways with COVID. But here we are again. And it is still a priority, and it's still something we're working towards. As we know, and as Representative Lanoue mentioned, the epidemic has not gotten any less intense. In fact, what we've seen through 2020 and now into 2021 is it's only getting worse. And this marriage of law enforcement with the substance use disorder community, the mental health community, will make a tremendous difference in getting people the help that they need. And of course, this legislation now is before the Public Safety Committee, where it will fall under the auspices of Representative Robin Green, who is our ranking member from the House. And Representative Green, if you could share some of your perspective on this, that would be helpful.
Thank you so much. And thank you all for coming. I truly do appreciate it. I'm Representative Robin Green, and as ranking member, I fully support HB 5586. In today's society, we have to do everything we can to help people who suffer from addiction. Expanding this very successful program will ensure those who need help will actually get the help. Addiction has affected so many of us here in Connecticut and in the United States, and treatment is key for everybody. And the one thing that is so difficult for someone who does have an addiction is where you go. And it's very difficult to find a bed. It's very difficult to find help. So I think this bill will ensure that we continue the successful program. Thank you.
It's my honor to introduce to you Griswold Pride Project Coordinator, somebody who has been there from the inception of crisis when it started off as in the pilot community of Griswold, and who's been there supporting us throughout this entire initiative. Miranda Mahoney from Griswold Pride.
Hi, thank you all for having me. I'm happy to talk about this program and the benefits that we've seen in our community because of it. Unfortunately, we were chosen as a pilot community because our numbers were so high. So the per capita overdose death rate, we were leading the state. And also we were leading the state in Narcan uses by the Connecticut State Police. And now to put that in perspective, we're a small little town in Eastern Connecticut, and to have that many fatal overdoses affect our small community, we really came together, and that's how Griswold Pride was formed. So we formed back in about 2015. It's a coalition of 12 different community sectors. We work to prevent youth substance use and then reduce adult substance use. And in about 2016, we were approached by Wayne Kowal from the Connecticut Statewide Narcotics Task Force and Detective Mike Mudry. And I had a previous relationship with Wayne working up in Putnam, Connecticut. And he, we went over the numbers, the data that we saw, and they were pitching this program. And it wasn't a new concept. It was based off of a national movement at the time through the PARI program, Police Assisted Addiction and Recovery Initiative, that was founded in Gloucester, Mass. And that they were just kind of getting started and making leaps and bounds up in Massachusetts. And that whole program was just starting to move across the nation. And so the task force kind of looked at that program, looked at some other programs that were going on out in Tennessee, and they kind of crafted a program that would fit the Connecticut State Police. So they based it off of a couple different things, and then adapted different programs to fit what we were seeing here. And so I really valued that they took so much time. They didn't just throw something together just because, we have a problem, let's do something about it. They really wanted to make sure it was going to work. So like I said, that started in 2016. They pitched it to our coalition just to gather feedback. And then it was launched in about May of 2017. At that time, I think we had 8 fatal overdoses that year. And by 2018, we were down to 4. So we did see a significant decrease in fatal overdoses in our town throughout the course of the crisis program. Unfortunately, our 2020 numbers, with what we've seen with COVID and the impact of that, we've seen the fatal overdoses raise this past year. But I'm just really proud of what we've seen, how the community embraced the program. And nationally, we don't have a lot of stats because once somebody's referred to the crisis clinician, DMIS hands it from there, takes it from there. We're not asking the state police to become social workers. We're asking them to, receive that training so they can assess situations, de-escalate crises, and then refer that person to a licensed clinical trained social worker, and that person will take it from there. So as Brian said, almost 600 people, and not just in Griswold, but in Troop E's region, have been referred to the social worker. The CIT training, I think, is a huge, huge asset to this program, because in order to see real change, you can't just have the clinical social worker as one resource. You have to have that capacity and to build the skills of the troopers to identify a mental health crisis, to identify something that might be substance use related. And I can share a quick success story on that. One of our resident troopers, he transferred up to Troop D, and he contacted me after an incident. He was a second on scene to a disturbance at a chain retail store, and the first trooper on scene was kind of handling it as like a criminal situation. And when the second trooper who arrived, who had the CIT training from Troop E, when he arrived, he was able to assess it and quickly identify that this was a mental disability. And through discussion and talking and the de-escalation techniques that he used, he realized that the person was actually under the watch of a caretaker. And this person left the care of his worker in the car when the caretaker was distracted with a phone call. So, he was able to de-escalate that situation and get the help that they needed. So it's just one quick story of, the benefits of the CIT training as part of this program. I'm happy to take other questions. There's so much I can talk about, but I just want to know, what do you guys want to know?
Thank you, Miranda. I appreciate it. And, as she said, we'll be happy to open up the floor to any questions you have for any of us regarding the program or the legislation.
Again, if anyone would like to ask a question, just put your name and news organization in the chat box, and we will get to you. Thank you.
I can speak a little bit more about the benefits. It's not just a connection to resources or treatment. It's not just the training, but overall with the Perry program, they've seen almost a 40% decline in crimes related to substance abuse. There's a huge reduction in recidivism. And there's a cost savings to this program because now people are being diverted from the criminal system and into the treatment system. But the biggest benefit, I think, is the cultural change among the law enforcement. So now they're looking at a substance use disorder or a mental health disorder as a public health, disorder and not a criminal disorder. So and that helps to reduce the shame, the stigma associated with substance use, with mental health disorders. And by reducing that shame and stigma, you're really creating a different culture for these people to seek the treatment that they need.
Thank you, Miranda. Again, if there's any questions, feel free to reach out to us. But no, we're having a hearing on this bill in front of the Public Safety Committee. I will be there along with Miranda testifying. Robin, you're going to be there as the ranking member, and we will be having this on Thursday. And then each member of the public is more than encouraged to submit testimony, submit your support for this very important initiative. And again, I want to thank Leader Perillo for your efforts on this very important initiative, and Representative Green for advocating so strongly in the committee. So we will see everybody Thursday. Robin, what time does the hearing start? Okay, I think Robin's screen is frozen, but we will get that information is out there, and we will share the links on how you can submit testimony and where you can see the hearing. So thank you all very, very much for being with us, and we will hopefully we will get this pushed forward and over the finish line this year. Very needed, very important. Thank you all very much.
Okay, one more final pass for questions. If anyone has one, go right ahead. Okay, everyone's good. Thank you for attending.